Hello there.
How are you?
I'm great. How are you doing today?
Good. Stacy's drink looked amazing. I only have my mimosa here. I wish I had her drink.
Well, the recipe is on the site, so we can make it during the week.
Yes, will do, will do.
Yes. So, Dr. Gendai Echezona, you want me to call you Dr. Gendai, Dr. Echezona?
That's always the question, right? So I don't know. It's a weird phenomenon, but somehow I don't like the Dr. Gendai thing that much because I feel like they only do that to women. Like we don't call, anyone else Dr. Samuel. So I
That's
don't like that
true.
because I want to, I want the same respect that the men get.
Right.
But Rita, it's weird because we're friends,
We're
right? So
friends.
to me, to you, I'm Gendai.
Yeah.
So
So,
I'm fine with Gendai because we're friends. But if you
yes.
have to let everyone know, it's Dr. Echezona.
Yes.
But Rita knows me as Gendai.
Yes. So I am going to refer to her as Gendai, but for all of you who are tuning in, this is Dr. Echezona. So we are going to refer to her as Dr. Echezona. And then if you two become friends with her, then you can call her Gendai. Oh man. Well, thank you again for taking the time. It's interesting doing these brunch buzz episodes, while it's still kind of like summertime, people are outside. So not everybody is, at home like during the pandemic tuned in. But I am excited that we do have some people who are tuning in. And the great thing about this is that, it lives on the interweb, so people can access it afterwards to get all this information that we're going to talk about today.
Good.
And so, Dr. Echezona, because there's people that are coming up here that were not here. Dr. Echezona, if you could just tell us a little about who you are, where you're from, and what you do.
Sure. So I'm from New York, Westchester County, a small village called Tuckahoe. So shout out to Tuckahoe because I see a few people that joined from there. So those are my people, a lot of my family. And I grew up in a small community there. So I'm from New York, stayed in New York. I'm an anesthesiologist. So the double board certified comes from a board certified anesthesiologist and a board certified pain management specialist. So just to clarify that. And I did my undergrad at Cornell University in Ithaca. And then for med school, I went to SUNY downstate in Brooklyn, which was a great experience. And then I did my anesthesiology residency at St. Luke's Roosevelt in Manhattan. And I did my pain fellowship at Cornell's Tri-Institute of Pain Management. So that was Cornell, Sloan Kettering, and the Hospital for Special Surgery. And now I'm currently practicing in Norwalk, Connecticut. I just opened during the pandemic. It's actually been a year already, but I opened June 2020 during the pandemic. And I just had the grand opening event this year because last year obviously wasn't a good time.
Okay. Well, I'm hearing a lot of big name schools there in this resume, Gendai. I don't think I even knew all of that. So this is not just like a doctor. This is a doctor who has practiced, has done residency at some of the top, hospitals, medical facilities in the country.
Yeah, it was a great experience. I loved all of my experiences that I had. I think when people look at it on paper, they're like, wow, this is impressive. But, you can get great training at most institutions. And I'm just fortunate that I have had the opportunity to attend some of the top institutions. And I hope that I represent them well and represent my people well.
Yes. Speaking about representing our people.
Let's just go.
Let's just get in here. It's funny when I thought about for this, this month's Brunch Buzz, because I've been trying to figure out where can I put Gendai, like what month would be great. And then this whole crate challenge thing took place. And and you posted something that was so funny. It was something like one of the memes with respect to the crate challenge, and I think I commented like, you're about to be booked and busy.
Yes,
and I was like, you know what, as this thing is, thank God it's not trending like it was before, but it sparked some conversation. I'm like, you have all these young people who are engaging in this activity, which they think, they're young, they're agile, but at some point they're going to have to pay for these
yes,
things,
yes.
right?
So, as a physician in this day and age, it's like we have to be on Instagram, which is difficult for us because that's not usually how we communicate. So
Mm-hmm.
I find a hard time like finding my, my space on IG. And I'm usually like planning out for the week what I'm going to discuss. And then I see this crate challenge everywhere on my timeline, my other page. And and I was like, all right, this is getting out of hand. I got to capitalize on this a little bit. But the crate challenge, like to everyone else, it was entertainment. But to me, it was scary. Because I'm like, I don't think people realize how seriously injured they could get. Now, some people are a little bit more agile than others and more athletic, and maybe they are up for the challenge. But I feel like I saw quite a few falls where I don't know what happened to that person afterwards. Now, my biggest concern was that people were not going to make it into pain management. Like they were going to have some major spinal cord injury where they were going to be beyond me. So I was like, this is a little dangerous here. But the other thing is, okay, so maybe you're hurt today, but people don't realize this acute pain today is going to be your chronic pain tomorrow. So please take care of yourself now.
Yeah, no, and I'm really glad that you pointed that out because, again, a lot of people think that, I can fall today, it's fine. I woke up the next day or a week later, I'm fine. They don't realize that months later, that sharp pain can be because of your crate challenge.
Exactly. Like it's like something's out of alignment, something's out of whack, and now you got to work on getting it back together. And I think when you're young too, a lot of the pain you experience, we may brush it off or it'll get better, or we're just treating it on our own, but sometimes we're ignoring it because we think we're young. But just because you're young doesn't mean you can't have serious injury either.
Yeah.
But not trying to scare people, because not all back pain is serious, and a lot of things can be treated on your own at home. So we can also touch on that too.
Yeah. So I want to get into pain management though, right? Because again, a lot of people, especially young people, might not really understand what that means. We usually, when I think about pain management, I'm like, oh, somebody got into a car accident and, they went to the physical therapist and, and they're dealing with their pain that way. But we, it's very rare that we really get an understanding of like, who is a pain management specialist? Sometimes I think we conflate that with a physical therapist. So if you could talk to us about what that is.
Yes. So a pain management specialist is someone who specializes in diagnosing and treating your pain, because not all pain is created equally. So we specialize in figuring out where your pain generators are coming from. I commonly refer to low back pain as the example because we know that's one of the leading causes of pain and disability that industrialized countries suffer from. So when we're talking about pain, sometimes it's muscular pain, sometimes it's from the ligament, sometimes it's arthritic, sometimes you have a herniated disc or a pinched nerve. And sometimes people are like, oh, I have back pain, and they think it's just one blanket treatment for everyone. So I think it's very important to figure out what the cause of your pain is so that you can work to find the appropriate treatment. Okay. So that's what we do at Pain Management. We're really looking to diagnose where your pain is coming from and finding treatment strategies for you. Now, a lot of people think about pain management in terms of medication, right? Like, oh, I'm going there and she's gonna like dope me up. But that's not the case. And for some of us, like for me, I'm an interventional pain management specialist. So I specialize in finding injections or procedures that can help you with your pain more so than just like popping a pill. Now, do I prescribe some medication? Yes, but I stay away from addictive substances. And you mentioned physical therapists, which I love because for me, treating pain is multidisciplinary. So, I want you to go and do your physical therapy. I want you to get your acupuncture. I want you to go to the chiropractor if that helps. I want you to take your supplements to decrease inflammation. And then, I'll give you the injection too to top it all off. But I think it takes multiple things to treat pain.
And I'm glad you touched on that because, again, I think people just think pain management, you're going to give me some drugs to make it go away. But it looks like within this discipline, right, like you are kind of working with all of these other disciplines, right, like the acupuncture, the physical therapist and, you know, even maybe some holistic practitioners as well too. So it's more of like pain management as like an experience as opposed to just, I see, that makes sense.
Yeah.
Okay.
Yeah. And there's a role, you know, for all of us. Like I know, you know, some people are like, oh, I don't want to do physical therapy. It never helps. And like, maybe you didn't see the right therapist, or maybe they just like sent you into a corner to do exercises. But with the right team, these things really do come together and work.
Okay. So outside of, you know, a crate challenge, like a fall or something like, or a car accident that would, you know, be maybe the cause of pain, right? How else do people like experience pain? Like, is it like weight, you know, like, because, you know, especially with this pandemic, a lot of people I think are complaining about joint pains. And I think a lot of us, including myself, has become a little bit of an oompa loompa, you know, and so, so I'm wondering, you know, because we hear these things about like, oh, I'm big boned or I'm this or whatever. So we're trying to figure out like, you know, does that really have anything to do with like, you know, body pains such as joint pains or back pains?
Yes, I'm happy you brought that up because it does. So, you know, a lot of pain can just come from, you know, wear and tear or overuse. And just think about it. You go work out, you know, overuse of that muscle and you're sore and you have some kind of discomfort. But over time, we can, you know, suffer from things like arthritis, which is an inflammatory process, or just the normal wear and tear in our bodies. But as we get older, too, some people are more predisposed to pain, like low back pain runs in families. Or as we get older, you know, you hear about, oh, my knees are hurting, and, you know, people are getting arthritis in major joints. But weight is a big factor in this, right? So if you have arthritis already in these joints, they're already somewhat compromised, and then you're adding extra weight that your body then has to support, and that just, you know, adds on to the situation. I tell some of my patients, like, you'd be surprised how losing 5 or 10 pounds can make a difference, especially with back pain or with knee pain. And a lot of people realize when I mentioned that, like, oh, you know, I did have more pain after I put on all this weight. So losing some of the weight helps decrease the stress on our spine, on our joints, and is helpful with decreasing pain. So, you know, there are people who have a smaller frame or smaller bone structure and people who have larger bone structure, but we do know that we can check percentage of body fat, so we can't all chalk it up to, yeah, I'm just big boned. Like, you know, that's usually not the case. But, you know, we can take into account some of those things. An old school method we used to do, which I don't even know if anyone does this now, I might be dating myself, is if you take your arm and take your finger and put it around your wrist. I don't know if you could see.
Yeah.
So if your fingers meet, usually it's like, I think your medium average bone structure, right? When they overlap, you may have a smaller frame. When they don't, you know, you may be big boned, but what if you have a fat wrist? And I guess it may not work. But so yeah, we do have different bone structure, but let me tell you, most of the obesity that we see here is not because we're big boned. We may not be eating the right things. We may not be exercising like we should. And I know for me, changing diet is hard. Like, I've grown up eating certain foods that it's just really hard to let go of. And a lot of those foods are also like pro-inflammatory things. Like, we're talking about, you know, breads or maybe sweets. Like, I like my desserts. We're talking about oils that are not our omega-3 oils. You know, there's so many things that are pro-inflammatory. We're talking alcohol, like, you know, things that we don't necessarily want to give up entirely. So lifestyle changes are never easy, but I think it's important to make them, and I think you have to make them like in a reasonable fashion, right? Not like, I'm just gonna stop everything. I'm gonna stop bread, I'm gonna stop alcohol. Like, I don't know. I think that's when we fail. So I think setting small goals, like, okay, so I'm gonna cut back on this first. Okay, I did well with that. All right, next is my fried food. I'm gonna back off the fried food. All right. I eat a lot of red meat. Maybe I could eat, you know, eat more fish or something. So it's minor changes we can make. And I think exercising is a big one. And everyone thinks about going to the gym, right? Like lifting weights, running on a treadmill. But a lot of studies have shown that just a walk in nature is very beneficial. So
Mhm.
you could go for a walk, doesn't cost you anything.
And I'm glad you mentioned, like these what would be seemingly little steps, right? Because there are those who are experiencing joint pains. And so they say that they can't exercise because they don't
Mm-hmm.
want to exacerbate the issue. And I think, by talking about taking a walk and doing little things, like even if it's around the house, that, every little bit helps. Because I have heard that from many people,
Yep.
like, well, my doctor said I can't run or I can't lift weights because I have joint pains. And so
Yep.
therefore I can't exercise.
Yep. No, there's always something you can do. We don't all have access to a pool, but if you did, you could swim, and that takes all the pressure off the joint. So there are some low impact exercises that you can do. I know the community center where I live, they offer very affordable like aqua therapy classes,
Mm-hmm.
and they even have financial aid programs. So if you say like you can't afford it, they find a way for you to participate. So I'm hoping that many of us have maybe some community centers in our area that are offering services that, maybe we just don't know about it.
Okay. So now, in terms of your patients that come to see you, when you assess them, do you go into like nutrition with them? Do you go into these things with them, or do you like or contract out to like a nutritionist or?
So when I do a new patient assessment, I do a complete history and physical. So I'm going over all of your past medical histories, surgeries, any medications that you're currently taking. We may touch on diet a little bit. I do encourage some people to see a nutritionist. Unfortunately, in medical school, they don't do such a great job with teaching physicians nutrition. So that's a little
Mhm.
bit of something that we have to learn on our own. So I do touch upon that, especially if I'm going to recommend like nutritional supplements. We do discuss that in diet. Also, if I'm talking things like supplements, I like to tell people how they can get it free in their diet first. And
Mhm.
then I will tell them when that's not enough, then you can supplement it.
Okay.
And a lot of what we talk about in pain management are supplements for inflammation. And a lot of it may be things we already like ginger, garlic, turmeric,
Mhm.
things like that. Eating omega 3, so that's our salmon, and cooking with maybe olive oil instead of vegetable oil. So I usually tell them like the free lifestyle changes that they can make first. And then a lot of times you may have coverage to see a nutritionist, but you just don't know it.
Mhm. See, yeah, and that's amazing that, again, we're getting all this information as to what actually takes place in the area of pain management. Because even though I know what you do, like there's a lot of this that I'm like, I didn't know that they talked about supplements and like, holistic practices, which a lot of people, are more into these days, right? But a lot of people are more into holistic practices as opposed to Western medicine. So it's good to see that that you're actually taking into consideration both of these aspects for like an
Yes.
overall, for the overall betterment of this patient, right?
Yep. Yep. And
Okay.
and I think it's very important because even when it comes to prescribing medication for pain, the medications that we prescribe may have side effects, right? So a lot of pain, like joint pain, we're like we need to decrease in this inflammation. But we all know like the anti-inflammatories can have side effects on kidneys or your GI
Mm-hmm.
tract. So I always try to suggest a more natural way for treating inflammation so we can avoid those things. But then I can't say that everything I do is natural because a lot of my injections are like steroids, right? So I'm
Mm-hmm.
injecting like steroids into your body. So it's a little give and take. I have to use, you know, many different aspects of medicine, but I think you can combine them all. I think we get into problems when we're all one way or all of another way.
Okay, okay. So I want to touch a little bit about pain management and the Black community, right? In terms of, I think, some of the like healthcare disparities and some of the things that we experience as Black people. at the hands of practitioners that don't always look like us, right? And I think we had talked about this on the last panel that we had done with respect to like health, disparities in the healthcare.
Yeah.
But I hear a lot of individuals, and I feel like was a victim of this as well, where we have some sort of medical procedure, some like a surgery, whether it be oral or whatever, and the doctor wants to give you one pill. And you're like,
You'll be all right.
and you're like in excruciating pain. And it's like, I just had surgery. How is it
Yeah.
that I could only get one pill? But there's this idea that, I guess within the Black community that, we're abusers of drugs, or that there's a stigma then that we're either going to sell the Vicodin or we're going to abuse the Vicodin. And so we end up getting the short end of the stick, whereas our counterparts, they might be prescribed 5, 6, 7 pills without question. And so I just want to know, like, what are your thoughts on that?
So healthcare disparities, unfortunately, are touching like every specialty of medicine, and pain management has not been spared. So there's a lot of discrimination, and part of it is because of inherent, I guess, discrimination that we are facing at large from white counterparts, right? Mm-hmm. Sometimes it's them doing it knowingly or subconsciously, right? Mm-hmm. And we usually refer to like Black women. We probably get it the absolute worst. Like, we're expected to always be the strong ones, right? Our pain is not taken as seriously. Like, if I'm saying I'm in a lot of pain and then a white woman is saying she's in a lot of pain, like, who are they believing more, right? Mm-hmm. We are often not treated adequately for pain, even acute pain, like postoperatively, right after surgery. Like, you deserve your pain management just as much as the next person. Now, they have put limitations on how much physicians can prescribe after surgery, but you are supposed to get at least, or at most, 1 week worth of medication. Mm-hmm. So somewhere between 5 and 7 days of medication after your surgery. And we have found that that is not happening. Or they're like, oh, you can just take this Motrin, but the person next door gets their Vicodin or their Percocet. Now, there are certain procedures that may not require opioids after surgery. But my thing is, if it doesn't require it for you, then it doesn't require it for anyone else. Right. And sometimes the little old white lady is the one that's giving her pills to her grandkids who are misusing it, as opposed to one of us who are taking it for the pain that we are actually suffering.
Exactly.
So this has been going on for years. And we talked at length about, this opioid crisis that's suddenly a crisis now, right? Mm-hmm. It wasn't quite the crisis when, it was us suffering from addiction and it was plaguing the Black community. But now that it's affecting largely the white community, now it's a crisis. Oh, it's a pandemic. Oh, these people need to be helped instead of incarcerated like they did with us.
Mm-hmm. Yeah, and it's one of those things that, no one is spared, right? We'll think that, maybe somebody from the Block or whatever, but it's like, professionals who are like, doctors, lawyers, like even medical professionals, like if they are seeing another doctor, like they're also getting
you hear these stories all the time from doctors and nurses, and we're like, if this is happening to us, imagine people who cannot advocate for themselves. Right. We know at least what's right, what's wrong, and can speak up about it, but there's someone who's just going to go home and suffer.
Yeah. And that's exactly why I keep saying it's so important to have, medical professionals that look like us, anesthesiologists especially, right? That look like us.
Yes, it is so important. And I've told like my staff this, I think, before, but I'm like, where are our people? Like, they're not coming. And I think it's because they're not being referred. I do accept patients without referrals, and the ones who do come are referred by maybe like a friend, a family, or someone who kind of knows me. But I'm wondering, from the doctors who refer patients to me, it cannot be that you don't have any patients that look like me. Mm-hmm. So I'm afraid that they're not getting the referral for pain management.
Yeah, I agree with you there. Because again, I think that there's just, from the lay person's perspective, there's this, I don't quite understand pain management. It's only when I get into a car accident or something like that. And I think from maybe the doctors or whatever, the hospital's perspective, they're just like, where, just go home.
Yeah. And I'm hoping too that, it's not that patients are like, oh, I don't want her to think I'm drug seeking. Like, I tell everyone anyway, like, trust me, like, I'm not trying to give anyone the drugs anyway. And I treat everyone's pain equally. And I'm trying to find a conservative way to treat pain for all of us, because while I do believe that opioids are necessary for acute pain, I don't believe that they play that much a significant role for chronic pain. And there have been studies that show that people with chronic pain on long-term opioids actually have worsening pain.
Wow.
So it's a phenomenon that, like, you're on these pain meds for so long that your pain actually gets worse instead of better. So I do try to explain that to people, and they found once you come off, your pain actually gets better. So for me, I don't give opioids for chronic pain because I truly don't believe that it will help you in the long run.
Yeah. And I think that's what separates like a good doctor and a quote unquote bad doctor, right? Because you're actually like, you're a problem solver. You're trying to actually get to the issue in the most conservative, like you said, way possible. And I think that that's what's important. And that might be why some people are kind of afraid maybe to even like seek pain medication, because they don't want to be placed on something where they're on it forever.
Yeah, that is absolutely true. Like, when I'm discussing options, I always say, okay, we have our options of physical therapy, medications, or injections. What are you open to? And then most people will say, well, I don't want any medication. And I'm like, just like a blanket statement, because I think they think all pain medications are addictive substances. So it's my job to educate people about the variety of treatments that are out there, and to let them know that, there are treatments that are out there that are not addictive.
Okay. So I want to move a little bit to the other side of your practice, which is the aesthetics, because that's something else that's also, I think there's a little misconception with that. Whenever we think of aesthetics, we're like, oh, I don't do Botox because black don't crack.
Black don't crack, right? So yeah, the aesthetic side, that's the fun side, I guess, of the practice. Not that I don't have fun with pain management, but it's just different. So with aesthetics, it's not just, Botox, I think skincare, in general, one thing that I push, that I tell people that you can do that's affordable, is sunscreen. I'm always talking about sunscreen. And that's like one of the biggest anti-aging hacks out there. That if you wear sunscreen every day, you're less likely to suffer from a lot of the changes, like the fine lines and wrinkles that we get from sun damage. That's part of our aging process. So I was fortunate that as a teenager, I was advised by a dermatologist to wear sunscreen daily. So I've been wearing it daily since, well, at least on my face. Sometimes I slap on my body. But since I was like 16. So maybe, people always say, you look so young. Maybe it was the sunscreen. I don't know. But I'm sure it's genes too.
Yes.
But yeah, so while I do Botox, I do fillers, I do some body sculpting with M-Sculpt. We do carry a few skincare lines. Two favorites are Jamarini and Elta MD. We do chemical peels, microneedling, RF microneedling. We do some non-ablative laser resurfacing for skin texture and scarring. So there's a variety of treatment options. We do PDO thread lifts. I think, like you said, sometimes we think we don't need it in the Black community, or we're ashamed to say that we do it, but I don't see the shame. Like, I would tell everyone anything that I've had done on my face. I Botox, I microneedle. I'll get in the mirror and microneedle my own face. I've done some laser resurfacing. I use a 5-step skincare system day and night. Like, there's no shame in my game. So.
Okay. And, it's interesting that you go into some of like the facial procedures, right? Because so for me personally, I'm like, I don't do facials because I don't want them messing with my skin. Because there was like some article years ago. I think it was St. Ives. They used to have this apricot scrub.
Oh, yes.
And they were saying that you were actually like scrubbing and like damaging your pores with the apricot pits. So I was like, I don't want anything like scraping my face. So that's why I've never done any, any.
I don't want that for you either. I don't want that for you either. Just stay away. No, so there's ways to resurface the skin, which I think is what they were trying to get. And you can do it without the harsh scrubs. Yes.
Okay.
And I think some of us too, if any of us were Sex and the City fans, we remember like episodes, I think was it Samantha that had something done and she looked crazy. So
yeah, I remember.
I'll always let you know if it's something that requires downtime or not. You'd be surprised. There's minimal downtime with a lot of procedures. But if it does require downtime, we will tell you that as we're discussing it. Like, listen, girl, you're going to need about 5 to 6 days before you get on your next Zoom call.
So it's interesting because, again, there's this concept of black don't crack, and that we shouldn't, we don't need to mess with our skins like you talked about. Like some people feel like they might.
I'll tell you who black does crack for: smokers.
Ah.
So
people who are smoking can crack if you're black.
Yes. And they have a lot of other skin problems, a lot of other health problems, but my back pain patients too. Like, you're not getting that blood flow to the spine when you're smoking, so you can't heal. So yes, smoking is a big one. So yep. So smoking and drug use, you'll crack.
You'll crack. You'll crack. Because we see people like Angela Bassett, right? Who I absolutely love. And I'm like, this woman's like 60 plus and her skin is just as tight, if not tighter than mine. And I'm like, oh my gosh, black doesn't crack. But then some of my friends were like, no, I'm sure she gets her facial rejuvenation, because I'm thinking that she doesn't do anything.
No, are you kidding? Yes, please. You've heard of Hollywood facials, right? They're getting stuff right before they like step out on the red carpet. So yes, the good part is they have the genetics, right? So they're starting with a good foundation. But let me tell you, I'm sure they have a good skincare regimen at home.
Okay.
So they're getting treatment. They're just sneaking out the back door.
So
I have a back door for anyone who needs to sneak out. We do have a back door. Yes.
Okay. So there's a back door. Okay, good.
Yes.
Because I might have to go through that back door. I don't know yet. I gotta see how confident I am. Because I think that, I'm in my, I don't know, mid to like approaching late 30s now, right? And I'm looking at my face and I'm like, I think it's still tight, but I'm like, how do I kind of maintain it? And I'm like, do I not do anything with it? If I start messing with it, am I gonna like be dependent forever on these things?
No, you can do something one time and say you don't like it and never do it again. The thing with aesthetics is you want to be the best version of you, right? Like you don't want to look like somebody else. So you want to go to someone who agrees that you just want a natural enhancement and you still want to look like Rita.
Yes. I don't want to look like Little Kim. I love Little Kim, but I don't want to look like Little Kim.
No, and there's so many, like I said, like just start with the basics. Are you washing your face?
Yeah.
Some people aren't doing that. Some people are like, I just let the water hit it in the shower. Like, that's not enough.
I've heard this phenomenon, and I thought that they were joking, but I've heard many people say they don't use soap on their face.
Yes, many people. Like, I've heard it several times. Like, oh, I kind of just, gets wet in the shower. No, you need to wash. Yes. So I think a good skincare regimen, it goes a long way for anyone. So some of the main things that I use, one, you want to use a good cleanser. Maybe some people use some glycolic acids in their cleanser that kind of helps like resurface the skin. Vitamin C, retinols, those are good for keeping the complexion bright, give you that glow, anti-aging to decrease the fine lines and wrinkles. We want things that stimulate collagen and elastin, so we're incorporating like hyaluronic acids. And then sunscreen again. So there are a lot of like simple things you can do. Just start with skincare. Like, you don't have to do the advanced procedures if you're not ready. You kind of, and anyway, if you don't have a good skincare, don't do the advanced procedures because one, you don't have a good foundation for it. Two, how are you maintaining the results?
See, that's good to know. And I don't think there are many practitioners that are actually saying that. I think a lot of people think that, wait, if my face is not that great, let me go get the enhancements and the stuff to make it. No,
you want to start basic and get a good foundation first. You probably need both, but you definitely need a system in place at home that you're doing day and night. Day and
Okay.
night. And I stress day and night too, because especially if you're wearing makeup, right? Like you wear makeup all day, you want to wash all that stuff off at
Hmm.
night. And some people, don't do that.
Somebody in the comments says, I want whatever a Dr. Echezona is using on her skin because and the googly eyes.
Oh, thanks. Well, listen, I do the absolute most. Like I'm not lying. I do a 5-step system. So I'm washing my face, a vitamin C serum. I'm using something called BioClear, and the person's slogan is "All is clear with BioClear," so it clears up
Mhm.
anything that's going on. And then I'm using a transformation face cream and a sunscreen during the day. Now that line that I'm using is called Jamarini, which I do carry. And she's a PhD chemist, and all of her things are scientifically backed. And she usually is published in the dermatology journals, and I use it myself. It works.
Okay.
It really works.
Well, we're going to need that skincare routine memorialized so I can post it on the page because I think even I was looking at your skin. I'm like, your skin, I always think your skin is beautiful, but I'm like, I don't know what's
Thank you.
happening today, but this is like extra glow. And I'm like, I
Thank
need that.
you. You know what? I didn't go outside today, but I still wear sunscreen to protect me from all the lights, even in the house or even what comes through the
Mm.
window. You still need that protection. So
Okay.
they, a rainy day, I wear it. A sunny day, I wear it. I'm staying in, I wear it. Like you just have to do it. And once something becomes a habit, like you stick to it.
Yeah. Yeah. Is it one of those things though? Because some people think that, if they use something for a while, it's going to turn on them and then now they have to look for another product.
No, I actually know people who are like, I've been using that for 10 years. So I'm not on
Mhm.
my 10th year of that. I have changed products over time. But you know what? Our skin does change over the years, and you may
Mhm.
have to tweak things a little bit. And I think, don't be afraid of the change. And as our skin changes, there are things that you can transition into. Um, and you can talk to me about those things.
Okay. So just a couple things before we let you go. I know there was a question earlier, and I want to make sure that we address that. This is kind of going back to the pain management world with respect to the question was, how do you feel about marijuana over opioids with respect to, I guess, pain management? Because now, marijuana is being legalized,
Yeah.
all over the place, and especially medical marijuana use has been around for a little while now.
Yeah.
So how do you approach that?
Yeah, so I think it's great for pain. So CBD definitely works on a system in our body that's called the endocannabinoid system, which helps with pain and inflammation. So we do know that marijuana does help with pain. Is smoking it the best way to do it? Probably not. I think the
Mhm.
studies show that ingesting it and vaping it is a little better.
Okay.
Now, it's a little more sophisticated than you think. And you don't necessarily need all the THC that has, the effects on feeling high or,
Mhm.
feeling out of sorts. So there is a way to use it without having THC and just
Mhm.
using like the CBD. Now, if you get a medical marijuana card and you go to the dispensary, I was like blown away by all the options that are there. Now, you just tell them what you want to treat and they'll tell you the formulations that's there. And it's something for everyone. You're like, I'll take this honey for my tea. Like,
Mhm.
so there's ways to get it. Or some people use it topically. Some people use it in oils, like a few drops under the tongue.
Oh wow.
So I think it's great. And there's also a company I use called Metagenics, and I've been using them for years. And they have other supplements that I've been using for years, but they also have hemp oils that you can use the drops. They also have
Mhm.
capsules with hemp extract. Um, and there's one that I really like. It's called PEA Relief, where it does have hemp extracts in it, but there's also something called PEA, which basically, I guess, enhances the effect on that endocannabinoid system that helps with pain. So you don't necessarily have to get a medical marijuana card.
Mhm.
Um, we do carry supplements in our office that have CBD in it to help with pain because I do think that's a great option and I would much prefer that over opioids. I just don't want you going to the corner and getting some unknown substance that may have something else in it
Yeah.
that's not going to be good for you.
Yeah, and I'm glad you emphasized that. And I think that knowing that there's so many other options and actually what the I don't want to say ingredients, but what the properties of the marijuana are that are actually good for treating the pain, I think that's important. So yes. So for those of you who probably were waiting this entire life to hear about marijuana,
Go for it. Just do it the right way.
don't go to your local connect, your plug. He's not gonna give you what you need.
He may give you what you need to keep coming back, but
Yeah.
that's not what we need for your pain.
Yeah. Okay. So I know that we talked a lot about like the facial stuff. Now the body sculpting, right? Because I know some people are really interested in that. And there's this idea like, does it work? Does it really work? Like, what is that? Do I have to come 15 times before I see like
Well, I don't do the body sculpting where I'm getting there with those rollers that you see. I don't know if that works. You guys can let me know if you've tried it, because I have not. And I don't think I can tolerate it. I don't know.
Yeah.
But what I do carry in office is a machine called M-Sculpt. And I have the ability to treat the abdominal area, the buttocks, biceps, triceps, so arms, inner and outer thighs, and the legs, so the calf muscles. Now, it is a machine with an applicator that you put on. It's a 30-minute session, and it contracts the muscles 20,000 times in that 30 minutes. So imagine you can't do 20,000 crunches in 30 minutes. You'd also be very sore if you contracted any muscle. So the technology is great in that it also has a mechanism built in so that you're not as sore after. So they have some like tapping mechanism to get rid of like the lactic acid buildup or something. So on average, for a particular body part, you would need 4 sessions over a 2-week period to get results. And the studies have shown, they've done studies with MRI looking at fat and muscle changes. So increased muscle by about 16% and decreased fat by about 19%. Now, if you couple that with some of the lifestyle changes, like, okay, so I'm going to exercise on top of that and change my diet. I've used it. I use it just for my abs to keep my core tight, because they also show doing the abs, you're stabilizing the core, strengthening your core. And if you suffer from low back pain, you probably hear me talk about strengthening the core all the time. So people have found like, oh my goodness, my back does hurt a little less.
Okay.
So it looks good and it's functional.
All right. I mean, I, am not in Norwalk, but I might have to make that trip.
Listen, we're here for you.
Because you said abs, and I've been trying to get abs for God knows how long, even before the pandemic. So
yeah, and you know what, too? We have people that like have really nice bodies, they're really built, and they're like, but for some reason, it's just my abs. I need this, So it's not like I have lazy people walking in the door like, fix me. A lot of times it's people who are in shape already, but they're like, I just need that extra like for my abs.
Yeah. Yep. I'm excited. Now, what about cellulite? Like, can cellulite really be removed? Because some people are skeptical. They're like, cellulite doesn't go away. Is that true?
So it's cellulite. It's natural, right? We all have it, right? And it's a lot that goes on with cellulite, right? With how the fat and collagen and tissues are like anchored deeper in the skin, right? There are treatments now. I don't have it yet, but I think I have to get it. It's called QWO, where you're injecting a substance that's breaking up the bands that are causing that dimpling in the skin. And then, because most of us don't really care about what's going on underneath. We care about the dimpling and the puckering that we see that's apparent, right? So there are treatments for that. And I don't know, stay tuned. I think I got to bring that in.
Listen, because I know within my circles, cellulite is discussed maybe once a week.
Yeah, yeah. And then everyone's going to, sell you a cream or a treatment, right? So I think with those creams, they're best used with another treatment, like not just alone. You get the best bang, you're helping the skin on the surface while you're working to fix what's going on underneath. So
Yeah.
just using the creams alone is not going to do it, but combining the cream with certain treatments will definitely do it. Some people combine like cellulite treatments with the M-Sculpt, right? So as they're like building muscle, decreasing the fat, they then want the skin to look nice. So they, so it's a combination treatments for that usually work.
Okay. Well, I love this. I feel like, again, I feel like I knew what you were doing, but I'm like, this is like a whole like package,
Yeah, it's like
right?
you know, but you don't really know. And every day
Right.
it changes because I'm always bringing in something new. So people are like, I didn't know you did that. Well, it's like, well, now I do.
So, Gendai, for people who are interested, they're like, listen, I need to book an appointment. I need to book a treatment. I need to book an assessment. How
Yes.
can people contact you? How can people get in touch with you? How can people book a session?
Yes. So for those who are on IG, there's a link in my bio. So the link will bring you to the website. So it will clearly say, if you want the pain division, click here. If you want aesthetics, I call it the body division. So you can click there. Also, it'll bring you to the website where you can click to book an appointment. It will direct you to call us because there's a lot of little intricacies and nuances. So I don't have online booking because we want to discuss a few things before you just walk in the door to make the best of our appointments, especially for pain management. We want to talk to you. We want to know what pain, what studies you've had. So my team is really good and will help gather all that information so that we have everything to use for our assessment on your first visit so you get the most bang for your buck. So you can go on our website. It's premierpaincareandwellness.com, or you can click the link in the bio for those on IG. And our phone number is 203-956-0022 if you just need a number to call. And if you're absolutely lost in the sauce and you're on my IG, you find me, Dr. Gendai Echezona, you can DM me and like, I don't know where to get started, and I'll help you out.
And she really does help you out because I have had to call her on a couple of occasions and I'm like, I don't know what's happening here. This is what the doctor is telling me. What do you think? Because sometimes, we go to doctors and sometimes we don't get, I don't want to say like the right information, maybe the best information for us. And it's good to be able to say, I know somebody in this industry. Could you please, point me in the right direction? Or maybe I got to come in and do a second, opinion with you. So, those instances happen too.
Or sometimes you just get too much information at once and you can't digest it all. And then afterwards, it's like, man, I would have asked this question, but I was so overwhelmed that I didn't know,
Yeah. So now your office is in Norwalk, Connecticut.
Norwalk, Connecticut. It's not far from my New York folks. I still live in New York and I drive in daily. It's a nice area. It's a nice drive. It's definitely not far and it's worth the trip for our New Yorkers. So I actually do have a big New York following.
Okay, great. Yeah, because I know some people in New York are like, well, I see Connecticut, so what does that mean?
Yeah, Norwalk is not that far. So yeah.
Okay, great.
Put it in your ways.
Yes. And the train is not a bad ride up there either for those who are really like who love public transportation.
Yes. Yep. Norwalk. Yep. You can get on the Metro North.
Okay. All right. Well, Gendai, thank you so much for
having me.
Yeah. I mean, this was such an informational session, I think. And we're going to have the live saved. So for those who missed it, they'll be able to watch it. And for those of you who are here and are like, man, my cousin needs to hear this, definitely send them the live so that
yes, I get those calls like, I need to talk to you about my daddy, auntie, uncle, somebody like, yes, bring it. Sometimes it's other people that have to let their family know, like, I think you need to see.
Right. So all of you are ambassadors on this live. So you're going to go and share this information with the others.
Yes, for sure.
Okay, everyone. Well, thank you again for tuning in. This was an amazing.
Thank you. It's always fun here to be here with you, Rita, as well.
Yeah, well, thank you.
You make me a little more comfortable than I usually am. Anyone who knows me knows I don't like being live for anything.
Dude, that's what I was saying. We were talking. I'm like, what is Gendai talking about? Like, she is like, she's doing amazing.
Thank you.
All right, everyone. Well, be sure to continue following the platform. Every month we have the Brunch Buzz episode with an amazing guest. This month we had Dr. Echezona. Next month, you have to tune in to see what we have. But again, please follow Dr. Echezona on Instagram. I love like what you do with the page. You're always giving some sort of nugget. She's staying in tune with, not just the old folks, but the young people, with the TikTok. So you definitely want to follow her. Oh boy, TikTok.
I know. It's like a necessary evil. I don't know.
Yeah, but you're getting the point across, which is the great part. You are getting the message across, and I think people are learning each time, you post something. So that's good.
I'm happy.
Yes.
Thank you.
All right, everyone. See you guys next month, third Sunday of the month.
Bye.
Bye.